Dr. Wenstrup.
Thank you, Mr. Chairman. You know, I hear from providers in my district and across the country every day about the challenges our workforce is facing in healthcare. You know, in 2020, as it's been discussed, Congress added 1,200 new Medicare-funded residency slots, and in 2022, I was proud that we passed a policy that allocated 10% of these slots to rural areas. And I'm concerned that despite this change in policy, slots are still being distributed in a way that doesn't really help rural geographic areas. As a physician who helped start a residency program, I understand what goes into the process and how valuable these training opportunities are for our nation's future healthcare providers. And our rural communities are facing critical shortages of physicians and providers. You know, residents are physicians, residents are providers. Granted, they are still being overseen and training. And Congress intended for these slots to provide fair and transparent distribution of graduate medical education slots to ensure these areas have access to high-quality health care. This bill does not take any slots away from urban hospitals. It simply fixes a loophole in the law that has enabled urban hospitals to reclassify themselves as rural in order to get benefits intended for truly rural hospitals, including access to more GME slots. We won't enhance residency training in rural areas if we let large urban hospitals leverage arcane loopholes to take residency slots dedicated to truly rural facilities. So I urge my colleagues to support this legislation as we continue to work on filling the needs where they exist throughout our country. Rural, underserved, wherever the case may be, we want to be where the patients can have access to care. So I'm pleased to support this bill. I agree with my colleague, Dr. Murphy. We must ensure the remainder of slots allocated for rural areas are distributed to those that they were intended for, which ultimately is patients in areas where care is scarce. And I yield back.